A client admitted to the hospital has been prescribed pyridostigmine as treatment for myasthenia gravis. When assessing the client for side effects of the medication, the nurse would ask the client about the presence of which occurrence? 1. Mouth ulcers. 2. Muscle cramps. 3. Feelings of depression. 4. Unexplained weight gain. Answer 2. Rationale. Pyridostigmine is an acetylcholinesterase inhibitor used to treat myasthenia gravis, a neuromuscular disorder. Muscle cramps and small muscle contractions are side effects and occur as a result of overstimulation of neuromuscular receptors. Mouth ulcers, depression, and weight gain are not associated with this medication. An adult client who experienced a fractured left tibia has a long leg cast and is using crutches to ambulate. In caring for the client, the nurse assesses for which sign, symptom that indicates a complication associated with crutch walking. 1. Left leg discomfort. 2. Weak biceps brachii. 3. Triceps muscle spasms. 4. Forearm muscle weakness. Answer 4. Rationale. Forearm muscle weakness is a sign of radial nerve injury caused by crutch pressure on the axilla. When a client lacks upper body strength, especially in the flexor and extensor muscles of the arms, the client frequently allows weight to rest on the axilla and on the crutch pads instead of using the arms for support while ambulating with crutches. Leg discomfort is expected as a result of the injury. A client diagnosed with myasthenia gravis is experiencing prolonged periods of weakness, and the physician prescribes an Edgerfonian test, also known as a Tensilon test. A test dose is administered and the client becomes weaker. How would the nurse interpret these results? 1. Myasthenic crisis is present. 2. Cholinergic crisis is present. 3. This result is a normal finding. 4. This result is a positive finding. Answer 2. Rationale. An Edgerfonian test may be performed to determine whether increasing weakness in a client with previously diagnosed myasthenic is a result of cholinergic crisis over medication with anticholinesterase medications or myasthenic crisis under medication. Worsening of the symptoms after the test dose of medication is administered indicates a cholinergic crisis. When tranylcypromide is prescribed for a client, which food items would the nurse instruct the client to avoid? Select all that apply. 1. Figs. 2. Apples. 3. Bananas. 4. Broccoli. 5. Sauerkraut. 6. Baked chicken. Answer 1, 3, 5. Rationale. Tranylcypromide is a monoamine oxidase inhibitor MAOI used to treat depression. Foods that contain tyramine need to be avoided because of the risk of hypertensive crisis associated with use of this medication. Foods to avoid include figs, bananas, sauerkraut, avocados, soybeans, meats or fish that are fermented, smoked, or otherwise aged, some cheeses, yeast extract, and some beers and wine. The nurse notes an isolated premature ventricular contraction PVC on the cardiac monitor of a client recovering from anesthesia. Which action would the nurse take? 1. Prepare for defibrillation. 2. Continue to monitor the rhythm. 3. Prepare to administer a beta blocker. 4. Notify the physician immediately. Answer 2. Rationale. As an isolated occurrence, the PVC is not life-threatening. In this situation, the nurse would continue to monitor the client. Frequent PVCs, however, may be precursors of more life-threatening rhythms, such as ventricular tachycardia and ventricular fibrillation. If this occurs, the physician needs to be notified. Defibrillation is done to treat ventricular fibrillation. The clinic nurse prepares to assess a client who is in the second trimester of pregnancy. When measuring the fundal height and comparing it to gestational age, the nurse would expect to note which of the following. 1. It is less than gestational age. 2. It correlates with gestational age. 3. It is greater than gestational age. 4. It has no correlation with gestational age. Answer 2. Rationale. Until the third trimester, the measurement of fundal height will, on average, correlate with the gestational age. A pregnant client tells the nurse about feeling wetness on the parapet and found some clear fluid. The nurse inspects the perineum and notes the presence of the umbilical cord. What is the immediate nursing action? 1. Monitor the fetal heart rate. 2. Notify the primary health care provider. 3. Transfer client to the delivery room. 4. Place client in Trendelenburg's position. Answer. 4. Rationale. On inspection of the perineum, if the umbilical cord is noted, the nurse immediately places the client in the Trendelenburg's position while gently holding the presenting part upward to relieve the cord compression. This position is maintained and the primary health care provider is notified. The fetal heart rate also needs to be monitored to assess for fetal distress. The client is transferred to the delivery room when prescribed by the primary health care provider.